If you are somebody who suffers from back pain, then you've probably come across the term piriformis syndrome. Do you know what that is? All right, so let's talk about it. So the piriformis muscle is a tiny muscle that looks like a fish, and it's essentially connecting the sacral spine to the hip. Its location is very strategic because it's lying right on top of the sciatic nerve. So that's why it can potentially lead to pain not only in the buttock region, but also pain shooting down the leg. And it is a common mimic to back pain that shoots down the leg, what we call radicular back pain, coming from a disc herniation. The pain in piriformis syndrome will be worse when you are sitting and will get gradually worse the longer you sit. It's really more of a clinical diagnosis and a diagnosis of exclusion, because we usually have to have an MRI of your back and potentially an EMG or nerve conduction studies to rule out that the pain is coming from the disc or the nerve roots. Now, treatment for this disorder will span from the conservative, so physical therapy, stretching, medications like muscle relaxants, NSAIDs, which can sometimes help. However, one of the best treatments for it is actually a trigger point injection inside the piriformis muscle. You will often feel a twitch when we actually go in with the needle into that muscle. Don't ignore piriformis syndrome. I've actually seen a few patients who unfortunately had lumbar fusion surgery for a pain that was thought to be coming from their lumbar spine. And then obviously the surgery did not help, and then it turned out that their pain was coming from the piriformis, and that could have been resolved with a tiny injection. So just something to keep in mind.